Marie Sinatra coming to you from the top of the falls. I'm on Goat Island in Niagara Falls, and I am so excited because I am going to bring you an amazing program about the Ovarian Cancer Project. Let's go inside and see what's going on.
Hi, I'm Joe DeMarco, founder and volunteer pilot for Wings Flights of Hope. At Wings, we know that health matters, and we are there to transport people when they need to travel for their medical care. We often see people that need to travel to other cities and get the best care that's available, and that's the purpose of Wings, is to never have transportation ever stand in the way of someone receiving the best medical care available. Keep watching Health Matters and learn about all the things that are available to help people for a better life.
Hi, I'm Michelle Giambardino from Face Fitness Skincare, a proud sponsor of Health Matters. We take pride in educating you on anti-aging solutions to help you obtain healthy, glowy skin. Continue to watch because your health matters.
Electronic Merchant Systems is proud and honored to bring you such creative educational television as Your Health Matters. We believe in we educate and you decide.
Kathleen, we are having way too much fun.
Oh, we are, Anne-Marie. I'm so glad you're here tonight.
Oh, thank you. You know, it is just such an honor to be here. I have had the opportunity to get to know you better throughout our affiliation and all the hard work that you're doing for this cause. And hats off to you. Hats off to you. There's no words. I'm in awe.
Anne-Marie, thank you so much, but I want you to know that I'm just one of many people who are the women of the Western New York Ovarian Cancer Project. We're all volunteers, there's no paid staff, and they all worked very hard to bring tonight together.
And it's so beautiful. Everybody is enjoying themselves, and we're by the falls, and we would be outside, but we didn't want to mess up our hair.
That's right. Yeah. And later on tonight, as you know, we're going to be lighting Niagara Falls Teal for ovarian cancer awareness. And we've had international attention on this. We're partnering with an organization called Globathon to End Women's Cancer, and we're part of a big happening tonight. All around the world, there are going to be icons and natural places that will be lit in teal for ovarian cancer. And of course, as you know, Niagara Falls is known around the world.
That's right.
Millions of tourists come here every year. They know what Niagara Falls is, and this is a big deal for women, not only here in Western New York, but around the world, that their cancer gets highlighted right here with Niagara Falls being lit.
Because, you know, we did have you on the program in the past, and we were able to educate people, and we want to give you a little bit of information tonight, but not too much, because tonight we're celebrating being here. But what do you want to say to people who are watching today?
So just to let you know, the Western New York Ovarian Cancer Project is a private nonprofit located in Western New York. We provide not only symptom and risk education, but we also provide services for women who have ovarian cancer with our Comfort and Hope tote bag that goes to every woman who's newly diagnosed. And this year we were able to add 2 professionally facilitated support groups.
Wow.
All the services of the Western New York Ovarian Cancer Project are free. So this fundraiser tonight is very meaningful in that it allows us to continue the good work that we do right here at home.
Wow. Well, it's an amazing night. I got my teal on. I got it all over. She said, make sure you wear teal. Wear teal for ovarian cancer awareness. And make sure that you contact Kathleen, follow her on Facebook, on your website, because there's lots of information that you don't want to miss out on, because you never know when you might need that information.
Absolutely, absolutely. And tonight we're going to tie in not only how important awareness is for ovarian cancer, but also important, we're giving Brian Higgins our inaugural Hope Award. And this is a big deal.
Yeah.
Brian Higgins is one of the congressmen who we visit when we go to Capitol Hill, and we visit him at home here too. And he has always said yes to us for federal funding for ovarian cancer.
Wow.
He's very committed to the cancer community in Western New York. So we want want to say thank you to him. We also want to impress on people, not only here at home, but around the country, how important it is that you speak with your legislator about ovarian cancer. And we're going to be calling on you to make sure that you come with us when we visit our congresspeople and senators here at home.
Absolutely. We're going to go find Congressman Higgins as well as a few other people to talk to, and we'll catch up with you maybe later, or at least when the Falls is going to be turning teal. So don't go away. You want to watch the whole program because you're missing a great event tonight. Thank you, Kathleen.
Thanks, Anne Marie.
Standing here with Congressman Higgins, who is receiving the Hope Award this evening. Congratulations, Congressman.
Thank you very much. It's a great honor.
Yes, it is. And well, it's also an amazing thing that you've been working so hard on behalf of this cause. So why don't you tell us a little bit about that?
Sure. Congress plays a big role in funding cancer research through the National Institutes of Health and the National Cancer Institute. In fact, since 1971, it was a couple $100,000, and now it's up to about $6 billion every year.
Wow.
And it funds promising new research at places like Roswell Park Cancer Institute to promote early detection of ovarian cancer and to test the efficacy of new therapies, combination chemotherapy, immunology, which is very, very important and very promising.
And I know that you've been a champion of this topic. So, is there a personal reason, or just because I know you're so proactive in the community with all that you do, but especially this?
Well, firstly, everybody's been affected by someone who has had cancer, and everybody comes through that experience changed. And they believe that there's more that we can do as individuals and more that we can do as a society to try to eradicate cancer in our lifetime. I'm a member of Congress. I take my responsibilities very seriously. We also have in Buffalo and Western New York, Roswell Park Cancer Institute,
yes.
The very first comprehensive cancer center in the entire nation. Today there's only 41, and they compete for over $6 billion annually in funding. So it's important to position Roswell so that when the next great breakthrough is made in cancer research toward a new promising treatment or therapy, that it's made right here in Buffalo and Western New York. And Roswell is also, as the anchor institution, the Buffalo Niagara Medical Campus, a major economic engine for the revitalization that's occurring right now in downtown Buffalo.
Wow, that's incredible. That's incredible. It must give you a great feeling to know that you can make such big changes in the position that you're in, because it's so many of us want to do things. Some of the viewers today might be wondering how can they help, and we're going to continue to give them information. But to be in a position that you're in to help affect change, to help change laws, to help educate, must be very fulfilling.
It is, but it's also frustrating at times when you see Congress making cuts in areas like scientific research, which is so fundamentally important, not only to the life quality of people in Buffalo and Western New York and throughout America, but also in terms of their health care. And it's short-sighted as well, because an investment in cancer research produces economic benefits, particularly in a place like Buffalo, with the rare and gem that we have in Roswell Park Cancer Institute.
Wow. Well, thank you again for all that you do, and congratulations on your award.
Thank you very much.
And yes to Kathleen, too, for all that she's doing. I know how much she appreciates you.
Yeah, she's a great champion.
Yes, she is.
Yeah,
yes,
thank
she
you.
is. Thank you.
Thank you very much for having me.
You're welcome. Dr. DuPont, I think this is the most wonderful place to have an interview.
It is. It's so beautiful here.
So, Dr. DuPont, you were one of Kathleen's doctors when she was first diagnosed, and you were at Roswell, and you have recently moved and come back just for this?
Yes, it's such a wonderful event. The Western New York Ovarian Cancer Project is such an outstanding organization. Their purpose is to just educate women about ovarian cancer and its risks, and they just do a phenomenal job. I was so excited to be invited actually to come back, so I'm glad to be here.
That's amazing that you came back just for this. And isn't it amazing what Kathleen is doing with her team of volunteers and as well as you doctors who just support her and help her so much.
Yeah, it's an excellent foundation. She started it, several years ago, but it's grown every year, and she's just done remarkable things. I think when you have passion for something, it's so easy to make it grow, and especially she's such a dedication.
Yes.
I mean, it's her personal mission.
Yes. So what can you say to people who are watching today to help? Because as we've been hearing all along with this, by the time this is diagnosed, it's usually in the later stages. So what can you share with the viewers today to help them not to be afraid of this, but yet to be proactive with their lifestyle?
Right. So for women, the biggest thing is just to take care of yourself. Women are so busy taking care of children, partners, relatives, that they put themselves last. If there's something that doesn't feel right, talk to your doctor. And if you have bloating or pain that's just not going away, that's persistent, let somebody know. Don't just say, oh, I'm too busy to think about this right now. Take care of yourself first.
And what is persistent? Because people might think 1 or 2 days. Is it over weeks or what? Because a lot of times, we're all guilty of that. We say, oh, it'll go away, and a lot of time can pass.
A lot of studies will show us these patients will have symptoms multiple times in a month where it doesn't go away, where it's, daily or almost every day, where just something doesn't feel right. And most women, if they sit and think about it, they'll think, yeah, something just really doesn't add up. Something's not making sense. I know my body. And it's just paying attention to those little things.
That's so important. Paying attention, taking the time to notice what's going on with you instead of taking care of everybody else all the time.
Exactly right.
Those are beautiful words of wisdom.
Thank you.
Anything else that you want to share?
Western Ovarian Cancer Project is an excellent organization. Certainly go to her website and see how you can help. Certainly there's always a need for donations and for volunteers to help. There's so much that needs to be done, and I know the group would love the help.
That's beautiful. Thank you for taking a few minutes out to talk to us. We really appreciate it.
Oh, thank you so much.
You're welcome.
We found a way to attack the fast-growing cancer cells without destroying the healthy cells. And now, Dr. Odunsi has said, we're doing clinical trials right here in Buffalo, the Roswell Park Cancer Institute in Immunotherapy. The prestigious journal Science, in 2013, said that immunotherapy is a science breakthrough of 2013. Clinical trials going on right now at Roswell Park Cancer Institute. As the doctor had said, what they basically do is they take the cancer-fighting cells in your immune system, the dendritic cells, they treat them to strengthen them and to expand them and put them back in the body, and they're directed to go and fight cancer. Great, great potential. But if we don't fund this kind of promising research, we will not have the results that we need as a nation. In our nation, we spend over $280 billion every year. Well, healthcare costs related to cancer, lost productivity. So there's a financial incentive for doing it as well. Here's what I want for my nation. Here's what I want for my community. Roswell Park Cancer Institute is only one of only 41 comprehensive cancer centers in the entire nation. It was number one. It was the first one. First documented evidence of public support behind cancer research. The prostate-specific antigen test was discovered there. Chemotherapy was discovered there. The critical links between smoking and cancer, tobacco use and cancer, were established there. So we learned that prevention is important.
I think a lot of people can be very afraid of getting into public policy advocacy or talking to a legislator. And if there was ever a legislator to try it out on tonight, it's Brian Higgins. Okay? You won't find a nicer guy than Brian Higgins. And we're lucky enough, Diane is lucky enough in Massachusetts to have legislators who say yes to cancer funding and yes to ovarian cancer funding. So we're lucky to have these people. But we need to keep the pressure on. We need to tell them this is important. And you know why that $166 million is there? It's because people like Diane and Barb and I went to our legislators and asked for it. They're sick of my story. They want to hear your story. I'll handle the technical stuff. I'll handle the asks. We will speak across the United States in one voice, asking for funding for ovarian cancer. So enjoy the awareness. This is a big deal. This is a big deal. But awareness without action doesn't move our cancer any further along. Thank you.
I'm standing here with Dr. Kunle Odunsi from Roswell Park Hospital, who happens to be one of Kathleen's doctors. Welcome, and thank you for taking a moment out to talk with us.
Thank you.
Yes, so tell me a little bit about what tonight means for you in terms of we're celebrating the month of September, which is Ovarian Cancer Awareness Month. You probably have a lot to share with us.
Yes, tonight is really very exciting because here we are with a group of advocates who are passionate about finding ways to help ovarian cancer patients. Because as you know, most ovarian cancer patients are diagnosed with advanced disease and they undergo surgery and chemotherapy and all kinds of treatment, which is tough on the patients and their families. And, to have a group of Western New York residents who are passionate and committed to helping these patients to go through their disease is really a wonderful event.
You know, Doctor, I didn't know you were going to say that, and I want to share with you that my viewers hear me say this all the time, that tragedy strikes all of us at different times in different ways, and how we respond to it really matters, that we can make a difference. And Kathleen and Congressman Higgins, who's here this evening, and folks like you are really making changes and efforts and making a difference.
Yes, I think, first of all, the Western New York Ovarian Cancer Project has to be applauded for what they are doing. I applaud them for honoring Congressman Brian Higgins, who is a major advocate for cancer patients all over the country, especially from Western New York. He is also a champion for the first comprehensive cancer center in the United States, which is Roswell Park. And I think he's, by honoring him tonight, it's very well deserved.
And as well as yourself too. Now you're in the trenches all the time because you're at Roswell. And if we could just talk just a little bit about why this disease doesn't show up until usually the later stages, and what can we do? The people who are watching today, we've educated them. Kathleen has been on the program before, and you can get in touch with her always. She has a little card that tells you the questions to ask your doctor. But what could you share with our viewers to help them? Because it feels, we don't want to feel helpless in this.
There are two key points about ovarian cancer that I would like to share. And the first is that the reason why most patients are diagnosed with advanced disease is because there are no good screening tests. I'm sure everyone understands, how you need to get pap smears and mammograms and other screening tests for cancer. Unfortunately, for ovarian cancer, there is really no good screening test. And so we encourage individuals to watch out for unusual symptoms. There is no classic symptom, but symptoms like abdominal discomfort or bloating, things that are unusual, should prompt a visit to their physician. So because there are no good screening tests, ovarian cancer tends to be diagnosed at a later stage compared with, for example, breast cancer or cancer of the cervix, where there are good screening tests. So that's the first point I want to make. The second point is that it is important for patients who are diagnosed with ovarian cancer to have their treatment in centers where there is specialized expertise. In fact, at Roswell Park, we call this multidisciplinary expertise. So you have a group of experts come together to put together their brains and minds and apply it towards the care of each individual patient. What is the best treatment for the patient sitting in front of us that assures the best chances for survival, for cure? What is the best treatment that maintains an adequate quality of life? Those are the things that we pay attention to. And I will encourage patients to go to centers where there is opportunity for this kind of multidisciplinary care.
Ah, that is beautiful, beautiful, beautifully well said. And I'm going to keep praying and hoping that you and your colleagues have advances. Just like a long time ago, we didn't have ways to detect different diseases and different things, but I'm going to hang on to the hope that you're going to have some breakthroughs to help us to detect this at a much sooner time frame.
Yes, so as a consequence of the challenges posed by ovarian cancer, I would like to share that Roswell Park investigators are involved in very highly innovative, cutting-edge research. Number one, in order to identify patients who are likely to be at risk. Roswell Park Cancer Institute investigators are developing strategies for early detection of ovarian cancer. They are still experimental at this point, but there's ongoing active investigation trying to develop new tests that will allow us to identify patients at a very early stage. In addition, new treatment modalities are being developed at Roswell Park for ovarian cancer patients. The most important development in the last few years is the ability that we and others have developed in order to unleash the power of the immune system to fight ovarian cancer.
Wow.
This is an ongoing effort at Roswell Park, and we have patients from the Western New York region and other regions of the country actually who are able to benefit from some of these strategies.
That is so exciting. See, I knew already. So you answered my prayers already. I'm hopeful, and I'm going to stay remaining hopeful. And what's important for viewers to know is what the doctors said. When you feel something that's unusual, excessive bloating, or excessive, what are some of the other things you said, bloating or indigestion, or just a feeling of something unusual. You can have like heartburn, abdominal pain. Those kinds of symptoms really should not be ignored. So you heard it again now, right from the doctor's mouth, that when something is consistent and stays, it's important to get proactive, to get a checkup with your doctor so that you could stay on top of your health, because it really does matter. And I am with Robin Mead, who's going to share a little bit with us, because you are a survivor.
Yes, well, it beats being called a statistic, so yes, I'm a survivor.
You have a wonderful sense of humor,
Well,
too,
thank you.
I must say. And I'll bet that really comes with beating something like this, that you can look at life in a much more positive or lighter way.
Oh, most certainly, yes. If you take everything so seriously, you'll never get through it. Just laugh. All you can do is laugh. Laugh at yourself. Let other people laugh at you or with you.
Yeah. So do you want to tell us a little bit about your story and how Kathleen and this ovarian cancer project has helped?
Oh, they have helped tremendously. I was first diagnosed in 2009, and there was no support group then.
Wow.
And when I came back in 2011, the support group was for recurrent cancers, which I unfortunately was recurrent. So I got to know the ladies in the group. They have been there for me through everything. And there have been a couple surgeries and a couple scares, and they've been there.
Wow.
They're wonderful.
Wow. And I just see the glow in your eye when you say that too. That's pretty amazing.
Yeah, they're just, I don't know how people do it without the help. My husband and my daughter are wonderful. My family is terrific. But it's nice to have somebody else, somebody who knows
Right.
what I'm going through.
Right, right.
It's so important.
And I like what you said earlier too about having a sense of humor and taking things lightly. And you know, too often we let the stress of different things that are occurring get us down and get really upset about trivial things when there's so much more at stake.
Yeah. I'll tell you, before my first chemo, before I lost my hair, it was Father's Day, and we had a family party, and I told my sister-in-law what worried me most was going to be losing my hair. And she looked at me and said, "Really? It's not like you ever cared what your hair looked like anyways." And I thought, oh, what a mean thing to say. But I used that when somebody else saw me and didn't know what I was going through. They don't know what to say to you. And I would say to them, well, you could always say what my sister-in-law said. So it was, as mean as it sounds, it was beautiful. It was an icebreaker.
Well,
So,
speaking of hair, looking at the falls, I want to turn around, give you the back end of our hair as our hair is blown all over the
Yes.
place, looking at this beautiful Niagara Falls.
isn't it gorgeous?
Yeah.
Just a perfect evening. I can't wait to see it Teal.
Thank you for joining us at the beautiful top of the falls in Niagara Falls, New York. And you heard today from so many people that knowledge is power only when you act on it. So get into action, and until next time, remember your health matters. Your Health Matters Minute with Anna Marie Sinatra from Sinatra Solutions. Think about what you're thinking about right now. Stop and notice your thoughts, because your thoughts become words, your words become actions, your actions become habits, and you might be stuck in a rut. But the good news is you can change it. How? By stopping and noticing what you're thinking. Stay tuned for more golden nuggets to learn how to take that thinking and switch it around so you can create success everywhere you go.
Hi, I'm Kimberly Will from Mr. Frank's, and I'm a proud sponsor of Health Matters, and I am very motivated and inspired by all of the information that the show offers.
Thank you, Matthew Sauer from Mattress and More, who helps to keep this program on the air. We appreciate your sponsorship, and we also appreciate you educating us on the importance of what we're sleeping on for 8 hours a night. Your health matters, so stay tuned, keep watching, and email us to let us know how much you appreciate all this great info.